In this video, we're going to have a look at how you can use one of these massage balls to reduce tension and sensitivity in the lateral hip, specifically to getting it into the gluteal region around the back of the greater trochanter. So, using the ball, our model Rose here is just going to demonstrate. Place the ball against the wall, slightly bend your knees so that you've got room to move up and down. Place the ball in the posterior lateral glutes, so you want it to go around the back of the lateral hip, around the back of the greater trochanter, but also just in front and around the side of the sacrum there. So essentially it's in the gluteal tissue, it's in the soft tissue. You don't want the ball rubbing over the hard areas, over the bony areas, because that's just going to be an uncomfortable and ultimately an unhelpful experience. So getting the ball in here, then with the knee slightly bent, it gives Rose the ability to move up and down, to move the ball through that tissue there, and she can move it through the soft tissue, moving it through some range. And if she finds a particularly sore bit, she can hold the ball in that position and just sustain that pressure for some time to get some desensitization, or she can just do some micro movements around there just to do a massage over that particular tender region. And what she's looking for here is a reduction in pain, a reduction in symptoms, so it should get a little less sore when she's been doing this for a short while. You don't want to do this for too long. You don't want to be there for any longer than a few minutes, and typically 10 to 20 seconds is absolutely fine. That's more than enough. Now, I did come across one unusual case study where a patient was on such strong analgesia that they couldn't feel much when they did this, and they actually pressed so hard that they caused a little bit of damage to the sciatic nerve and gave themselves some nerve symptoms, some paresthesia, some pins and needles down their leg, which lasted for a short while. And that was quite a unique case. So if you have a patient which is on a lot of strong pain relief, and I'm talking here typically opiates like morphine or something, then just be careful with this, that they don't get too carried away and then pressing so hard that they're squashing nerve tissue. That's rare, but it's just something that you might want to think about when you're educating patients on how to use the ball. It's not a case of no pain, no gain. It's a case of being smart and just using this enough to reduce the symptoms without actually causing any unnecessary aggravation. You don't need to get the ball in there with a huge amount of pressure. You just need to get it in the right place and just to spend a bit of time desensitizing that region there. So I've been talking for a while now, and Rose has probably been doing this for more than a couple of minutes. So we'll stop there, and Rose will also demonstrate a technique on the floor. So you can also do this technique on the floor, and you just need to make sure again that you don't put too much weight down through. So Rose is holding her body there with her leg, with her arms, and turning her body to the side so the ball's getting into the lateral side of the glutes, and she's just being careful not to place too much weight through the ball. Now, for an active individual, this might be a great way to do it. It's perfectly easy to do, but for somebody who's a little less mobile, they might struggle to get into this position or to move fluently through this position, and there also may be a risk that they put too much pressure down through the ball, which is where the standing version can also be beneficial instead. Okay guys, I hope you found that helpful. Please leave a comment below if this is a technique which you've tried and found to be successful.